This government meeting is brought to you by Eastworks and our local cable subscribers.
I'll make a motion to start the Board of Health meeting at 5:31 on March 11th.
I'll second that motion. All in favor, Beth, yes?
Steve, yes.
All right, I'm going to read the opening remarks first. In accordance with Mass General Law, we are required to let you know that this meeting is being recorded. We will begin the meeting with 15 minutes of public speak time. 3 minutes per speaker. Raise your hand if you would like to be recognized by the chair. Please note that during public speak, the board will be actively listening to your input for future discussion, but will not be responding to any comments at this time. Please do not speak unless recognized by the chair, and all comments should be addressed to the board. You can also submit a question or topic for later discussion via email to the health@easthamptonma.gov email. All right. So with that, do we have anyone present currently for public speak?
Nobody.
Nobody. All right. All right, then we will move on to agenda item number 2, approving the meeting minutes from February 18th, 2026. I did review the meeting minutes today, and I had no concerns or objections or questions.
I also reviewed them. I have no objections or questions.
All right, should we make a motion?
Yeah, excuse me, sorry. I'll make a motion to approve the meeting minutes from February 18th, 2026.
I'll second that motion. All in favor, Beth, yes?
Steve, yes.
All right, and we'll move on to item number 3, Director of Public Health update.
Thank you. So far in March, inspections have been excellent. From January 1st, we've done 236. We just found out today that the health department got approved for inspection software. So complaints, permitting, payments will all be able to be done online now, which I think will be awesome. Just to keep on your radar, the short-term rental or city ordinance is moving forward. It is meeting with the ordinance committee on Thursday, and then if that goes well, it's gonna go up to city council for final approval. So that should be, if I had to guess, I'd say that maybe out in the next couple months, where we would start permitting short-term rentals in Easthampton. There's around 40, 45. And just community outreach has been excellent. I can't thank Brad enough for his help. A couple things coming up in May. Brad and Irza are going to be doing a presentation at the Council on Aging on having a healthcare proxy, which I think will be excellent. In April, on April 1st, the mayor is going to be doing a flag raising for Child Abuse Prevention Month. And then last week, Brad and I had our first meeting with the Overdose Awareness Committee about hosting the 3rd annual Overdose Awareness Vigil, which is going to be August 17th. And then on March 18th, I am going to be doing a brief nicotine-free presentation to City Council and the city residents, just giving them a brief summary of what the nicotine-free generation is and the proposed updates we'd be proposing for our tobacco regulations. That being said, I'm definitely looking to hold a hearing the last week of March, first week of April, if you have any availability that week, around 6 p.m. in person. And other than that, just finalizing the budget. It's a level budget. The only major difference is I have requested and received initial approval from the mayor just to increase the administrative assistance hours to 20 hours a week. And then 21 Love Field, it's an ongoing battle. 2 Mondays ago, we were in court received the court order for the board that the Board of Health will be able to abate the violations, cleaning the property. We got that all set up, had it ready to go today, had the cleaning crew there to clean the property. And then I received a notification from the city attorney that the property owner, an interested party in the property that has the items, filed a stay. So we had to unfortunately hold off on that until our next court hearing, which will be in 2 weeks. So that's just a bit frustrating, but we're still moving forward as best we can on getting that property cleaned up. On the city's end, we have approval from finances, and we're just waiting for the new court approval to continue with that. And that is all I have.
All right, thanks, Ryan. So in terms of the meeting, or the hearing, did you have, I mean, I'm definitely available that last week of March. So I don't know if you want to throw out a couple options or if we want to discuss it now, but
Yeah, definitely. Steve, how's it looking for you that week?
Are we talking about the week of the 23rd?
No, I'm talking about the week of the 30th. So I guess March/April.
Unfortunately, I have a procedure on the 26th. I'll be out of work for a few days, so I could do anything starting the week of April 13th for a hearing.
Yeah, perfect. Just give more time just to finalize the regulations, let people know. Because my goal is to get it posted on the health department website as well.
Okay.
So the week of the 13th, how's that look for you, Beth?
yeah, it should be fine any day except for Monday. I mean, Wednesday would be good if it's predictable for me. But yeah, you said 6, right?
Mm-hmm.
Wednesday is predictable because I'm usually done by 5. But
Yeah, me too.
that works for everyone else.
Yeah, I mean, I can pencil it in now.
Just double checking, making sure city council. No, city council is Wednesday the 15th, city council.
Yeah, that's right, because that's like the 3rd Wednesday.
Yeah.
Okay.
I have the 14th open too, 13th, 14th. What are your busy days at work?
It's different every week. It's
Sure.
a little tricky, unfortunately. Typically, I'm able to make something at 6. It's just that it's in person, so I want to make sure.
Yeah, exactly.
Yeah, we can try the Tuesday. I mean, unfortunately, the nature of my job is sometimes
Completely
unpredictable. I can
understandable.
do everything in my power to get there by 6 on Tuesday, the 14th, if that works.
Would 6:30 be easier for you?
Yeah, I'm open too.
I mean, it'd be more of a safety net. So yeah, if you think that 6:30 would work, that'd be fine.
All right, yeah. So let's plan for Tuesday, April 14th at 6:30. Brad, does that work for you?
It does, yes.
Perfect. All right, I will schedule that right now. It's just so we have the school committee conference room.
Yeah, and that gives them, the public, plenty of advance notice too. So
They give them that required 14 days exactly.
that's good.
Perfect.
All right. Yeah, Steve.
What's the new software you guys are using called?
It's called Permitize. It's what the building department already uses for permitting. So if
Okay.
anyone has gotten a permit through the building department, they won't have to create a new account.
Sure.
But it's great because it'll log all our complaints. It'll log our inspection types. It'll allow people to pay online as well as allow them to fill out applications online. So it'll hopefully ideally reduce mail and people coming in to have to fill out applications.
Okay.
But I'm excited.
Yeah, great. Yeah, that's the only question. Thanks.
Yeah, that's awesome. All right. All right. Are you good to move on, Steve?
Yes.
All right. So number 4 on the agenda is the health inspector update.
All right, good evening, everybody. Just a couple updates. We're wrapping up the winter farmers market on the 22nd. So we have one last inspection. We'll have the other inspector go out just to wrap it up. Cultural Chaos is canceled for 2026 this year. I believe that's due to funding. Ryan, correct me if I'm wrong. And then also for inspections, food inspections we're down to 13 establishments on that 3-month tracker. So we are getting those down back to the biannual inspections, which is excellent. From I think it was 19 prior to that. So bringing that down. And then we're just working on our March biannual inspections. We are pretty much caught up for the most part on those, almost done. Mobile food truck inspections, those are coming in. Pretty much a couple a week at this point. We're getting those scheduled with fire to do those together. And then for camps, I'm starting to put together the presentation for that. And then I will be sending out an email to all the camps around probably the end-ish of March, beginning of April is what we're shooting for. So get those all squared away. The list of all the approved mobile food trucks I forgot to add, those are all updated on the website as well. And then for housing, Ryan and I are going to a housing court training, which will definitely come in handy because we have quite a few that, we're kind of having to go to court for. So that will be good training. We're doing that next Thursday in Devon's, Mass. Complaints received since our last meeting, there's about 11. Just mostly general housing complaints for the most part. Updates on reoccurring ones. I have 531 East Street. For that one, no improvement. So I'm just going every month, just finding them at this point. I've been talking to the person that owns the property. He's told me he's going to do a junk removal. It hasn't happened. So just try and talk with him more, but things aren't really changing. So we're putting, I think, 113 Loudville in priority for court, and then as well as 21 Lovefield is what Ryan was saying. Speaking of 21 Lovefield, 83 Garfield Avenue, we just got a complaint on that. It's the same owner as 21 Lovefield. So we'll be working on that. We sent a correction order out for that for miscellaneous bulky items, kind of like a smaller version of what's going on there. And that's pretty much just a brief summary of what's been going on so far, but so far so good.
All right.
Thanks for the update.
You're welcome.
Curious, the mobile food truck inspections that are listed, those are just the ones you've approved so far. Assuming if they're not listed, you just haven't inspected them yet?
Yeah, that's correct. So those are just the ones that Dan and I have passed, and I'll keep adding them, and then I'll have Ryan will update the website as well for all the ones that are able to be operating in Easthampton.
Great.
Awesome.
All right. Next on the agenda, number 5, community health worker update.
All right, thank you. Yeah, so, just a little bit of overlap with what Director Griffin was talking about earlier. Since we last met, I produced the memo that you all received in your packet. There's a lot of information in there. I've produced a PowerPoint slide that I'll be able to, cover at the in-person meeting. It's going to cover the exact same stuff that's inside the memo that I gave you, but a lot shorter and more punchier, sort of straight to the point. I think maybe 10 minutes max. I can get through everything in the presentation. That'll also leave time for Q&As as well. I'm also happy to answer questions about it. If you had the time to read it, I know probably not with your work schedules and the length of the memo, but so that work is nearing its completion. And then just to expand a little bit more on the work that we've been doing with Learn to Cope. So that's the organization. They're inside the mill here in Easthampton that works with friends and families who are impacted by overdose. And so as we're planning the candlelight vigil, the conversation has sort of shifted to, what could we do to make something really symbolic and meaningful for the community? And so I had this idea of creating a remembrance garden inside Easthampton. So there is a parcel of city-owned land that's just down the hillside from the mill. It's in one of the flood catching facilities. I don't know what it is. I'm not a planning person, but it's meant to funnel water from the mill in case there's any sort of flooding. And so the land that's around this is not really used for much. So I started having conversations with folks within the city, the planning department, DPW, the mayor's office, and just sort of put a proposal together and said, could we in theory tap into the opioid abatement funds to create a memorial type park for these family members. It's really advantageous because Learn to Cope is just right up on the hillside. So after they have support groups and things like that, folks could just walk right down, into the park area. So that work is continuing. Ryan and I will meet with the planning committee that's doing the candlelight vigil in maybe 2 weeks, I think. We'll probably be touching base with them again, just to sort of get that initial information out to let them know that the city is on board, and then we just need to, iron out some final details. And then the last piece of research that I'm working on for you is just some, troubling trends on Kratom being sold in Massachusetts stores. Right now, we don't really have an issue with it in Easthampton, but I also don't want to have it be a situation where we wait for something bad to happen before we act. The literature is very clear. A lot of it's very technical and medical based. I'm going to provide a literature review for you all. You're more than welcome to dig through all of it if you need to, but again, some of this is, biochemical literature. Some of it's public health literature. So to the extent that you can, process this large ecosystem of knowledge that's coming out. So I intend to send that to you all probably within the next month, just to give you an environmental scan of what's happening on the ground, what other communities have been doing, and what we could theoretically look for potential solutions if you wanted to act on it. And then in terms of outreach, so the Easthampton Wellness has a meeting that's starting tomorrow, and that's just a bunch of stakeholders to come together and talk about things within the community. I've been invited by Officer Emma Riley to join that work, so I will be doing that monthly going forward. And then also I was given an invitation to the Opioid Abatement Working Group. That's spearheaded by the Northampton Department of Health, but it's a regional working group collaborative to look at best practices and solutions for how to equitably spend the abatement funds in ways for restorative justice. So, I've been making my rounds. People in the city are aware that I'm here now. So I imagine the work will transition more towards outreach and education with the community now that they know that I'm here. So that's all I've got for you now. Happy to answer any questions.
That's awesome. Thank you so much, Brad. I did read your entire memo. That was very educational. I appreciate it. And I particularly like the section at the end with anticipated questions, because for me as a Board of Health member, I'm going to definitely want to be prepared and obviously rely on you and your expertise because we're going to have lots of questions and comments from the public. So one thing that I specifically would love to be prepared to address is the specific jurisdiction that we have as a Board of Health in this situation, because
Yeah.
that's come up before. And I know you had mentioned Brookline, and that lawsuit, but I assume that was also their Board of Health that passed that policy.
Yeah,
Okay.
that's correct. Yeah, the framework that is being used across Massachusetts is through existing Board of Health regulations. So I'm more than willing to comb through what the other communities have done and the sort of language, and I can point to our regulations that are within your authority to say, here's where the authority to enact a policy like this occurs.
Yeah.
Yeah, I agree. It is 100% in your wheelhouse to act on this. And I know that sometimes, I think particularly when it comes to policies like this, it has a potential to become political. And it isn't a political issue, it's a public health issue. And that is absolutely your authority. And, with much respect to my former colleagues on the city council, this is not an authority that's granted to them through regulation. So happy to produce more information for you before the meeting occurs.
Yeah, that would be great. Especially coming off of a pandemic and, that all of that scrutiny that the board had to.
Yes, I completely understand. And I know, there's also a strong likelihood for special interest group narratives to kind of take hold in the types of stories that we tell about liberty and morality. And of course, those are going to be present, and you'll probably hear some of that feedback from the public. But it's important to know where the narratives are factual and evidence-based and where they are driven by the stories that we continue to tell without actually knowing where the stories come from. So always a good critical thinking exercise and excavation about the stories that we tell about governance in the United States. So happy to do all that for you.
Yeah, that's great. Thank you.
And I'll work with Brad as well on just making sure all this information is on the website well in advance. The Mass General Law allowing the Board of Health to enact this regulation, as well as answers to some anticipated questions, just to be proactive about it.
I wonder if we should also prepare something on paper that, like, either it be whatever, that people can actually look at with like bullet points. And,
okay,
that's a really good idea.
Because there's going to be some still that will show up and who haven't seen anything online. So I'd love to I really, as a board, am wanting to come at this as like an informative hearing as opposed to a defending ourselves type of situation.
That's why I'm so appreciative of Brad and his non-biased.
Yeah.
Sometimes I get my health department goggles on and I can only see one thing. So it's really good to have that.
Yeah,
right. Absolutely. Yeah. I certainly also have my own personal feelings about this topic, but that's not my role. My role is to give you what the actual information is, and then you all get to make the decision based on the information presented. So that's my promise to you.
Great.
And just to reiterate, no decision is going to be made at the hearing. It's just going to be a listening session, and then a decision can be made after you guys have thought about it at the next Board of Health hearing. It's just for community members to speak and share their thoughts.
That sounds good.
Sounds good to me too. Thank you, Brad.
Yes, thank you so much, Brad, for all the information, and we'll plan on that April hearing. Did you have anything else, Steve? I kind of dominated there.
It was a great presentation, very professional, straight to the point, broken out like an SOP.
All right, very good. We will move on to number 6, Board of Health regulations review / discussion.
No, I'm not too much. I sent the draft of the regulations that are being proposed for the update to our tobacco policy review. Take a look. Any questions? Just feel free to email me or send it back. My goal is to get that posted on the line either end of this week, early next week. Apart from that, that's the only thing we have on the horizon. And then, like I said, short-term rentals are coming soon. And then Brad is still working on Kratom, which I just learned about. I know something Hunter did a presentation on. I think not in October, the previous October. It's something he's working in Westfield now, and he's still very adamant about it and very informative about Kratom. So just something on the horizon.
That sounds good. Is this just a question? This item has been on the agenda the last couple of meetings. Is that like are we doing this as an ongoing agenda item just to bring up anything that's currently being discussed, or was this put on specifically for this meeting for the tobacco? Or
no,
okay.
just ongoing.
Okay, great.
A few regulations that we have on the radar, but no, it just
okay.
ongoing.
I just want to make sure, because I know like last meeting someone thought we were going to be specifically voting on things. So okay, very good.
No, if it's ever a vote on anything, I'll make sure to be specific.
Yeah, great. Just thought I'd clarify in case there's anyone listening or. Yep. All right. Anything else for you, Steve? I'm good.
No, I'm okay with keeping it as like a standing review every month.
All right, sounds good. And you'll be emailing us, Ryan, with that tobacco policy and anything else that you have it. Okay, very good. All right. And then I guess we're ready to go to item number 7. Items not reasonably anticipated by the chair 48 hours in advance of the board meeting. I have nothing.
I have nothing.
All right. Very good. Then if there's nothing else, I think we can wrap up.
All right. I'll make a motion to adjourn the Easthampton Board of Health meeting on Wednesday, March 11th at 5:58 p.m.
I'll second that motion. All in favor? Beth, yes.
Steve, yes.
All right.
Have a great
Have a
night.
good evening. Thank you, everyone.
This government meeting is brought to you by Eastworks and our local cable subscribers.